Mhm.
And when you provide more higher level care, more sophisticated dentistry, more comprehensive care, what happens is the numbers of a practice go up organically.
This is Growth in Dentistry, a dental intelligence podcast where we ask the question, what does growth in dentistry look like to you? I'm Katie Polson, a dental hygienist and your host. Welcome to another episode of Growth in Dentistry. I'm Katie Polson, and if you are new to the show, welcome. We're so glad to have you as a listener. I hope that you gain something, just a little bit about these episodes. The goal with these is to give you 30 minutes of actionable advice, whether you're on your way to work or from work. Something maybe that you've heard of, you want to implement again, or maybe it's a totally new thought process to you. So grateful that you're here. If you are a reoccurring listener, so glad that you're here. Thank you. If you are into Facebook, maybe people still are into Facebook, I hear. The Dental Intelligence podcast community is a great place to come and gather together and join like-minded data nerds and come learn from one another. And also this podcast is brought to you by Dental Intelligence. So we have a great giveaway for those that listen to the show. You can go to get.dentalintel.net/podcast to get a $50 gift card when you complete a demo. So, and I'll make sure that link is in the show notes, but without further ado, because we have 30 minutes, we're going to get going today. I have a special co-host with me today. She's never been on the show. She's a lovely, lovely person, Jenny. Thank you so much, Jenny. Guys, I said it wrong again.
It's okay. You're not the only one to get it wrong. My last name is unique. I will help every listener. It is Adieli.
Adieli. Yes. And she's the best. Tell us a little bit about your background, because we have similar backgrounds and it's so fun to talk to her.
We do. I got my start in dentistry in 2007 as a dental assistant and did that for a few years until I got the courage to expand my education and go on to hygiene school. I practiced hygiene for about a decade, and COVID kind of stirred everything up for many like me. So I found my fit in dental software, and that's how I ended up here at Dental Intelligence. And I've been able to kind of provide more actionable tools for hygienists and office admin and doctors and practices just to kind of streamline what they do. So I am still in my dental field, but just from a different viewpoint. It's been fabulous.
Awesome. Well, we'll have her on in other shows. So, but glad to have you here for the first time. So Jenny and I had the opportunity to speak to our guest last week, and he did a CE, and we'll make sure to link that in our show notes on this particular topic. But we were doing the CE. I was like, he needs to come on and talk, just do a little teaser about it. So, Dr. Steve Katz, welcome to the podcast. Thank you so much for spending another afternoon with us.
It is my pleasure to spend time with both of you and with all of your listeners.
Yes, thank you so much. So, Dr. Katz, tell us a little bit about yourself for those listeners that may not know you.
Well, I guess I have what you could call a diversified background in dentistry. I began my career in oral surgery. After doing cancer surgery for a couple of years, I got burned out on the outcomes that unfortunately half my patients would still pass away and the other half would end up grossly disfigured. So I decided to move back up to restorative and general practice where I could be more constructive. Wow. I've had some interesting experiences as the team dentist for the New York Jets football team.
Woo-hoo. Wow.
And, it's fun to talk about this week after our victory this past weekend. The New York Jets may not have been the most successful team in the league, but I can guarantee you the years I worked with them, they had the best teeth.
That's awesome. I have to do a shameless plug. Go Seahawks, but we'll allow your Jets, Dr. Katz.
Okay. Well, your coach was a good friend of mine with the New York Jets, Pete Carroll.
Yes.
Became very good friends with him during his time here.
That is so cool. What an amazing career. And I bet you're one of a kind as far as going from oral surgery to restorative, and then in your career with the Jets. That's pretty awesome. So,
and even more exciting now in doing what I'm doing now and helping coach doctors to grow their practices, develop a higher standard of care, and create more patient appreciation of the value.
Yeah, we can tell with our time together, I can tell how much you love dentistry and how you want to give back to the people that are continuing
Absolutely.
to serve their
Yeah.
patients. So it's really great.
Absolutely.
So, in your CE, we talked a lot about case acceptance, and for the month of November on the show, our theme is we're talking about increasing case acceptance over the holidays. But really, what the goal is to talk about case acceptance in times when maybe people are tightening their purse strings a little bit. They're not willing to do the larger cases or maybe the more cosmetic cases that people really want to do, that dentists want to do, right? But that being said, we're going to start with just kind of the first missed common opportunities, because you have so much to offer in this field of what are some of the most common missed opportunities you see amongst teams when presenting larger cases or
So
cases in general. But
the first obstacle, I think, is that doctors may tend to have a narrow view of comprehensive care. So many times coming out of school and training and even early years in practice, they're concentrating on identifying the crown, the restoration, even the quadrant, but not looking at the bigger picture. I always had the philosophy that every patient walking into my practice was potentially a full mouth reconstruction until they showed otherwise. Now, obviously, 95, 98% of them did prove otherwise, but it just showed that I was looking towards the big picture, towards restorative, cosmetics, function, perio, cosmetics, functional problems of cross bites and two planes of occlusion. And when you start to look at the little things and they start to add up, all of a sudden you start to see that these cases become full mouth reconstructions.
Sure.
yeah,
Um,
I love that
another,
idea of going from like large to small. I mean, so often we're so focused on the one tooth, right? That's bothering them.
Mhm,
Yeah, I love
sure.
that. So good.
Another
And
problem
that
that I
has to,
see,
sorry to interrupt you there, Dr. Katz, and that has to do with how they, chart and just kind of organize that plan before presenting it, right? Because you want to look at the big picture, like you mentioned, Dr. Katz. And sometimes it's nice just to identify all the needs, function, cosmetics, form, and then just maybe the way that you communicate it to the patient, you can kind of hone in on priorities or phasing out specific needs. That's what I did
Mhm,
often as a hygienist and collaborating with
sure.
the doctor. It was, what is the big picture and how can we properly communicate this effectively to
Yeah.
the patient?
Well, it sounds like, Jenny, you understood what the real function of a hygienist was. And the main responsibility was not the clinical part. It was not the education part. It wasn't even the relationship part. It was increasing perceived value.
Correct.
Because if you can increase perceived value in what we do, then it opens up the patient to many, many more opportunities. What gets in the way of that sometimes is not having clear diagnostic criteria within a
Mm,
practice.
Yeah.
If there are multiple doctors, they have to be on the same page, and the hygienists need to be brought into that page.
Yep.
The other
Absolutely.
thing that most practices fail to do is develop the thought process in their hygienists. Yes, they can identify particular teeth, but do the hygienists know how the doctor thinks in developing a case? So it requires lots of opportunities for the doctor and hygienist to sit together and work through the cases together so that the hygienists appreciate the thought process that goes into creating a large scale treatment plan.
Absolutely.
And the more times that a hygienist has that opportunity to sit with their doctor in doing that, the easier it will be for them to predict with more certainty what the doctor will be planning to do and how he'll go about it or she'll go about it. And the last thing that gets in the way of most dentists is approval addiction.
mm.
Define
Dentists
that
tend to, mhm,
for our listeners.
sure. Well, approval addiction is where we kind of hold back on giving patients the truth because we're afraid they're not going to like us, and if they don't like us, they may go elsewhere for the treatment. So it's very important to liberate yourself from approval addiction, to separate the message from the messenger. And as I said in the program we did last week, one of the tools we use to do that is something called a permission statement, where we get permission from the patient to give them the truth about what we see and also about what treatment they could benefit from.
Yeah. So good. So many good. I'm just making notes as you're talking here because there's just so many good little key things there. One question that I have is how do we, so you've got the team. I mean, as a hygienist, I've done this many times, but I know I have a lot of friends who struggle with maybe they want to have that relationship with their doctor. Or the doctor wants more out of the hygienist. They want them to fill that role, but they're just not on the same like plane. They're not talking. They're just not communicating very well. So when you say they get together and almost have a meeting about diagnosing and making sure they're on the same page there, what does that like technically look like? What like how often do you think that they're meeting and stuff like that? Because I think that could help some people kind of move past just the idea of it and actually implementing it.
The more time you invest on the front end of a relationship with your team, and in this case, the hygienist, the less time you're going to have to backtrack as that relationship goes on.
Absolutely.
So that in the beginnings where I used to schedule, an hour a week with my hygienist going through the development of our bigger cases. And that didn't have to last very long because they started to think the way that I did. A lot of doctors fail to realize that in practice, they should be the least important part of the equation in whether
Hard to
patients
let
will
that
accept a
go.
large treatment plan.
Yeah.
I think you're absolutely right, Dr. Katz. And it's funny looking back into when I was practicing, that was a priority in our alignment. My doctor would always, we would communicate. I had the expectation set for me early on. And with a little time and experience and finesse, you kind of start to pick up on the way that their philosophies play out. Some
Sure.
dentists are more proactive, some are reactive, some will just tell it like it is and then attack it head on. And so once the team picks up on that, they're able to just in symbiosis, just work together and communicate those needs very clearly. And one thing I would say is a really great way to effectively do this is with perhaps maybe a morning huddle or some sort of daily or weekly, like Dr. Katz said, meeting where you can start to look back and say, hey, these are what we were looking at last time, or maybe we need to address them today. Let's reiterate. So just a short connection at some point in time is a great way for those teams to align.
I think the dental intel huddle is brilliantly created, but I want that huddle to focus on today.
Mm-hmm.
Yeah,
And
absolutely.
topics like team development have to be put off to another time.
Yeah.
So I would say scheduling time each week to have these development meetings. Jenny, listening to you talk, it's like listening to the hygiene coaches in my company when they're talking to our
Hey,
doctors
maybe
and trying to
I've
get
got
them
something else under my belt here.
Hey,
I've got a
stop
few good coaches.
stealing
Just
her.
kidding.
Just kidding. No, I love this conversation. It's really great. And I think that's really helpful for a lot of people to understand.
It's
Maybe
about
start with an
empowering the
hour.
team.
Yeah.
Absolutely.
Start with an hour and go through like why did you make the decision to do a crown here instead of an onlay or an onlay, whatever it is, and kind of getting aligned and giving them, because you don't have time for the patient. I love what you said about preparing, you can't do it right in the middle. I don't, there's so many times where the dentist is my brother that I work for. So like, you'd think that we would like have a time to talk and I would know, but like there's times where like I see him on Sunday and that's when we talk because it's not in the practice, because we're just so
if
busy.
you fail to plan, you plan to fail.
Yeah.
And
exactly.
Love it. So good. Okay. Well, let's get a little bit more into because you've practiced through many seasons. So what is your opinion on periods of time where maybe we were going into a recession or where people are tightening their purse strings a little bit more and not willing to spend? What advice do you have for practices that are kind of gearing up for getting, and what can people do to get case acceptance accepted, I guess,
Well,
during those periods?
number one is getting, again, the entire team on the same page. Because if you have patients who have questions, if you have patients who are nervous or a little anxious, they're going to ask multiple people the same question.
Mm.
They're going to ask the hygienist in the room, do I really need that? They're going to ask the assistant, can I wait on that? They're going to talk about all sorts of questions about urgency. If they get different responses from different members of the team, that inconsistency destroys confidence.
Absolutely.
So that entails scripting. It means bringing patient-centric, benefit-oriented scripting to the team so that when given the same question and an opportunity to help a patient overcome some objection, everybody will respond to it in the same way. And the most important thing is to constantly not be talking about what we're doing or how we do it, but to always be talking about the benefits of what we're doing. Because our patients do not buy crowns from us. They don't buy implants from us. They don't buy hybrid complex cases from us. They buy the benefit of having that dentistry done.
Health.
So
They buy
we
health,
need,
right?
health,
Yeah.
being able to function, being able to sit in the picture with the rest of your family with a big smile on your face
Exactly.
instead of
The-
being ashamed.
I
It's
love that.
understanding these life problems and life disabilities, and that as dentists, we truly have the power to make a difference in people's lives.
I
And
haven't.
going along with what you said there, Dr. Katz, about, making sure all team members are on the same page. One thing that I remember practicing was the power of 3. And I'm not sure if this is, scientific, but when a patient is able to hear the value of that treatment and, how it will benefit them from the hygienist, from the assistant, from the doctor, from office admin when they're presenting the treatment, the more they hear it and that message is consistent, that's going to boost that case acceptance. There's no doubt about it.
Yeah.
It
Yeah.
doesn't happen happenstance. Marketing experts have studied that extensively. They
Yeah.
know that people will process 3 pieces of information
Mhm.
and they'll respond to it when it's said a minimum of 3 times. That's why infomercials are not a 30-minute infomercial, but they're a 10-minute infomercial played exactly the same 3 times consecutively.
Yeah. Yeah. One thing that I don't think that we've had and I'm trying to think, I'm sure maybe we have, this is the 80th episode of this show, but
Congratulations.
oh, well, thanks.
Dentistry.
Wow.
But I'm just trying to
Prolific.
think, that's not something that someone has brought up, which is the why. It feels a little bit almost taboo. No, I feel like the book Start With Why by Simon Sinek is like so overplayed and over talked about now that it almost seems like whatever. But really, and we so focus on the business aspect of starting with why, like, why did you become a dentist? Why do you know what I mean? But I love that you talked about the like why should they care? Why should they care about the dentistry and start there and then move into the how and what when they're ready to hear it. That's
Exactly.
such good advice.
The dominant mental state that most people walk around in, unfortunately these days, is what's in it for me.
Yeah.
And so when they're sitting in our offices and we're telling them they need to do something, they have to do something, it can almost sound like it's our agenda and it's for our benefit. And for some of the doctors, unfortunately, it is. But it's are you developing a mentality? It's not about, when growing a practice, it's not about increasing production. It's not about increasing collection. It's about giving your patients the opportunity to make better health decisions for themselves and receive the highest standard of care we could possibly provide. And when you provide more higher level care, more sophisticated dentistry, more comprehensive care, what happens is the numbers of a practice go up organically. And you don't have to think about numbers. That's why, being a dentist-driven management consulting company, which is different than most, We are care driven, not money and numbers driven. We embrace the analytics and the metrics that we can derive from dental intelligence. And we use that to help guide systems, and the actionable data that you provide for us gives us tools to measure what's being done. But the bottom line has to be, are we positioning ourselves to give our patients the best possible standard of care? And then are we giving patients the ability to appreciate the value of that care?
Absolutely.
If we do that and we communicate that value properly, our patients are going to want the care, and we can get that word need out of our vocabulary. I hate when doctors tell patients they need a crown. People
Write
don't
that
need
down,
teeth.
Katie. Do not say need.
I will not.
Well,
I will
and
not.
it's our responsibility, right? We take an oath to recommend treatment and not just assume, oh, well, this is a poor college student. We're not. It brings me back to this event I was recently at where a speaker was talking about how they were in college and, malocclusion was real, bite was off, function was not ideal. And he had no knowledge of ortho whatsoever. It was never discussed. It was never brought up. And he got out of college, was an adult, went back to his dentist and said, hey, why didn't you ever recommend this for me? And as a 40-year-old went through and got Invisalign or whatever product that, he needed to get. But the fact of the matter is, just because someone appears that they wouldn't be receptive, or you're afraid that they may not give you that permission, it's our responsibility to present whatever treatment is needed for that patient, whether that's small or a large case, right?
Sure. I'm a big believer that words have to be precise because they're so important. And just like Katie, you're going to stop talking about need.
Sure. Yep. I'm going to try.
Jenny, what I want you to take out of your vocabulary is treatment.
Okay.
And replace it with the word care. Because
Quality
treatment
care
is something we do to someone. Care is something we do for them.
Great insight.
That's really good. Okay. All right. I'll stop talking about that. There was one thing that I don't want to glaze over before we ask our last question. A half an hour goes by fast here in this show.
Does.
Sure does.
Is that you talk a lot of times we have people or practices who have a hard time delineating between like what to do with our numbers and the metrics and reporting they get from our analytics software, and what that means for the care. Sometimes it seems like it's either or. It's either you care for the patient and that's what or you measure and report, and you have production. And I love that you've kind of married those two together in your mind. That so maybe if that question even makes sense, but make kind of expand on that thought process. Yeah.
I'm going to take a look. I mean, dental intelligence is irreplaceable to me in providing metrics and analytics for a practice. But the way I look at it is a little bit different. I look at metrics and analytics not to help me change numbers, but to help me be more reflective in self-evaluation of, and what I want every dental team member to always do is to look at an interaction they've had with a patient, and at the conclusion of that interaction to think, is there anything I could have done or said differently that would have made that a better experience for that patient? Is there anything I could have done or said differently that would have opened up the opportunity for that patient to want a more or a higher standard of care? And then to take that with us in every subsequent patient interaction, so that we're constantly looking to exceed expectations. And the more we exceed expectations, the more trust and confidence the patients have in us. To use it as a self-measuring tool, not just the numbers that measure what's going on in our practice.
Yeah.
Love that.
That's really great insight.
Growth in dentistry, right? You're constantly learning and excelling and changing what needs to change in order to provide a better outcome.
Yeah. Well, that leads us, Jenny, just come on, you can be here every time. Because if you've listened to the show previously, you know I'm not that great of a host. But
Oh, goodness.
Jenny would be great.
You're
After
doing
80
a great
episodes,
job.
I find that hard to believe.
Okay. All right. So Dr. Katz, we asked this question to everybody, and it's because dental intelligence growth is a really big deal to us here. And it means something different to everyone. So what does growth in dentistry mean to you?
Patients receiving the highest possible standard of care, patients appreciating the value of the care, being able to enjoy dentistry in a less stressful environment with a higher level of fulfillment, understanding that what we do is not fixing teeth or healing gums, but that we are changing lives in the patients that we care for. And using all of those things that I just spoke about, that in the end, our practices grow, our teams are more fulfilled, our teams are happier, and we can share the benefits of all of that with our team so that we all come away with just a greater feeling of satisfaction for what we've accomplished together.
Wow.
Wow.
I feel like he just described dreamland, like a dream, like a heaven,
Is that La La Land?
utopia,
No, that was beautiful.
utopia of dentistry.
Yes.
I
Yes,
was
very good.
I was very, very fortunate to experience that in my practice over
Wow.
many years.
Good for you.
And I'm at a point in my career where you think about what is your legacy. And I always thought that my legacy was that I provided an amazing amount of high-level dentistry to so many patients.
Mhm.
Last summer, I found out that that was not my legacy. I had a pretty stable team in my office from 2002 to 2015, but I had let my practice go in 2015 to devote my time to coaching, so that my team had not been together up until last year for about 6 or 7 years.
Mhm.
And then I found out that one of the members of my team's mom had passed away, so I went to the funeral, and she invited me to come meet her at one of the other team members' homes for lunch the following day.
Mhm.
And when I went to lunch that day, I walked in and I found that my entire dental team was there,
Mm.
and that they were still 7 years after ever practicing together, they were still best friends.
Mm.
And what I realized at that point in time was that my legacy was not the dentistry. My legacy was creating an environment and an atmosphere that enabled people to make meaningful relationships in their life
Mm.
and have them extend far after the work experience.
Nothing better than that.
Wow, you said that so beautifully. And for those of you that
Yeah.
have listened to the show before, you'll know. And Dr. Katz, you don't know this, but my dad was a dentist. He passed away at 65. He practiced for
I'm
30
sorry.
plus years. And talking about legacy, the people that, I mean, one of his treatment coordinators spoke at his funeral, and they're still very much friends. And talking about a legacy of creating a space, dentistry is so unique in the way that we have the ability to impact the lives of not only our patients, but the people that work there with us.
Absolutely.
And I have no doubt that your legacy is going to reach far beyond you. So that's really awesome. Well, thank you
Thanks.
so much for joining. It's been a pleasure, always a pleasure, Jenny, to be with you.
Oh, thanks.
This has been Growth in Dentistry, a Dental Intelligence podcast. Again, this special thanks to our guest, Dr. Steve Katz. Dr. Katz, if they want to reach you, how can they do that?
Okay, you can reach me at Dr. Katz, DRKATZ, at smilepotential.com. My office number is 516-599-0214. That's the office for Smile Potential, my coaching company.
Okay.
And my cell number is 516-524-7573. I welcome calls and texts and anyone who wants to just talk.
Perfect. I will make sure that those get in our show notes as well. Okay. Thank you so much. Thank you to our marketing department for all their work on this podcast. I'm Katie Polson. Keep growing.